Hey everyone, hope you're having a great day. You're listening to the RX Daily Dose. Today's episode is being recorded for Monday, October 3rd, and I'm your host, Ian Parnagoni. We update this podcast for healthcare providers, medical professionals, and anyone who has an interest in drug updates. Don't forget to like, share, and subscribe on all your favorite podcast platforms and social media, including iTunes, Spotify, YouTube, and Instagram. All links can be found in the show notes below. So we have a few things to review this week. First, the FDA issuing a warning against some odd and potentially dangerous social media challenges which have been coming up. And then we have approval or updates of 3 products, Skysona, Relyvrio, and Relyvrio. As always, feel free to skip around. I'm going to include times in the show notes so you get the updates that interest you. First up this week, the FDA issued a warning about recent social media video challenges which encourages people to cook chicken in Nyquil, which is a combination of acetaminophen, dextromethorphan, and doxylamine, or other OTC cough and cold medication, presumably to eat it. The challenge honestly sounds silly and unappetizing, and it is. But it could also be very unsafe. Boiling a medication can make it much more concentrated and change its properties in other ways. Even if you don't eat the chicken, inhaling the medication's vapors while cooking could cause high levels of the drug to enter your body. It could also hurt your lungs. Put simply, someone could take a dangerously high amount of the cough and cold medicine without even realizing it. And then an earlier TikTok challenge urged people to take large doses of the allergy medicine diphenhydramine, which is sold in many products, including some under the brand name Benadryl, to try and induce hallucinations. Prompted by news reports of teenagers needing to go to the emergency room or in some cases dying after participation in this challenge and taking too much medication, the FDA warned the public about the danger of high doses of diphenhydramine. So, how can you keep your friends and family safe and help prevent potentially harmful trends? First, keep both OTC and prescription drugs away from children, and lock up these medications to prevent accidental overdose. Sit down with your children and discuss the dangers of misusing drugs and how social media trends can lead to real, sometimes irreversible damage. And remind your children that overdoses can occur with OTC drugs as well as prescription drugs. If you believe your child has taken too much medication and is hallucinating, can't be awakened, has had or is having a seizure, has trouble breathing, has collapsed, or is showing other signs of drug misuse, call 911 to get immediate medical attention, or contact Poison Control at 1-800-222-1222 or online. Social media challenge or not, it is important to use medications as intended. For OTC drugs, you should always read the drug facts label. The label tells you what the medicine is supposed to do, who should or shouldn't take it, and how to use it. The drug facts label uses simple language and is an easy-to-read format to help people compare and select medicines and follow dosage instructions. It's important to remember that OTC medications are still medications, and they should be taken only when needed and with caution. The FDA also granted accelerated approval to elavaldagine autotemcel, which goes by brand name Skysona, the first cell-based gene therapy indicated to slow the progression of neurologic dysfunction in boys 4 to 17 years of age with early active cerebral adrenoleukodystrophy, commonly known as CALD. Childhood CALD is a life-threatening genetic condition caused by mutations in the ABCD1 gene, which leads to buildup of chemicals that cause inflammation and damage in the brain. The condition affects only males and typically presents with symptoms of inattention, behavior difficulties, and neurologic dysfunction between 4 to 10 years of age. Left untreated, symptoms typically progress to neurologic disability and ultimately death in the second decade of life. Prior to the approval of Skysona, there was no FDA-approved treatment, but standard of care treatment for CALD is allogenic hematopoietic stem cell transplant, where the patient receives stem cells from a donor. Given challenges finding an appropriate donor and toxicity associated with the transplant, there is a substantial unmet medical need for boys with CALD. This application was granted a rare pediatric disease priority review voucher, in addition to receiving orphan drug and breakthrough therapy designations by the FDA. More information on Skysona may be found on the FDA's website. The FDA also granted accelerated approval to selpercatinib, which goes by brand name Relyvrio, for adult patients with locally advanced or metastatic solid tumors with a rearranged during transfection, that's RET gene fusion, that have progressed on or following prior systemic treatment or who have no satisfactory alternative treatment options. You can hear more about Relyvrio in episode 34 from back in May of 2020 when it was originally approved. The most common adverse reactions in patients participating in clinical trials were edema, diarrhea, fatigue, dry mouth, hypertension, abdominal pain, constipation, and headache. The recommended Relyvrio dose based on body weight is, for less than 50 kilograms, 120 milligrams orally twice daily, and then for greater than 50 kilograms, 160 milligrams orally twice daily. And finally this week, the FDA approved sodium phenylbutyrate and torucidiol, which goes by brand name Relyvrio, to treat patients with amyotrophic lateral sclerosis, which goes by ALS, commonly referred to as Lou Gehrig's disease. ALS is a rare disease that attacks and kills the nerve cells that control voluntary muscles. Voluntary muscles produce movements such as chewing, walking, breathing, and talking. ALS causes the nerves to lose the ability to activate specific muscles, which causes the muscles to become weak and leads to paralysis. ALS is a progressive disease that continues to get worse over time. Most cases will result in death from respiratory failure, usually within 3 to 5 years from when the symptoms first appear. Approximately 5,000 individuals in the U.S. are diagnosed with ALS annually, and approximately 20,000 Americans are currently living with the disease. Relyvrio can be taken orally by combining 1 packet and 8 ounces of room temperature water. It can also be administered through a feeding tube. The recommended dosage for the first 3 weeks is 1 packet, that's 3 grams of sodium phenylbutyrate and 1 gram of torucidiol daily. After 3 weeks, the dosage increases to 1 packet twice a day. The medication can be taken before a snack or meal. The efficacy of Relyvrio for the treatment of ALS was demonstrated in a 24-week multi-center randomized double-blind placebo-controlled study. In the trial, 137 adult patients with ALS were randomized to receive either Relyvrio or placebo. The patients treated with Relyvrio experienced a slower rate of decline on a clinical assessment of daily function compared to those receiving a placebo. Additionally, longer overall survival was observed in a post-hoc long-term analysis of patients who originally received Relyvrio versus those who originally received placebo. The most common adverse reactions experienced with Relyvrio were diarrhea, abdominal pain, nausea, and upper respiratory tract infection. Relyvrio contains torucidiol, a bile acid, which may cause worsening diarrhea in patients with disorders that interfere with bile acid circulation. These patients should consider consulting with a specialist before taking Relyvrio. The prescribing information includes additional information on risks associated with Relyvrio. The FDA granted this application priority review designation. It also received orphan drug designation, which provides incentives to assist and encourage the development of drugs for rare diseases. The FDA granted the approval of Relyvrio to Amylyx Pharmaceuticals. And that's all I have for right now. I hope you enjoyed today's episode. I'll include all links in the show notes below, so please go back and check those out too. Please connect with me on any of your social media platforms and give me feedback on what you heard today. I'd love to know what you thought about the episode. And as always, feel free to like, share, and subscribe wherever you listen to your podcasts. And thank you so much for tuning in. Stay safe out there, and I hope you enjoy the rest of your day.